All right, let's start today with a COVID update. We haven't done this for a while, and increasingly the numbers in the United States are looking better and better as vaccination takes place. We've seen the slowdown due to vaccine hesitancy. We will talk about it. We have also now seen evidence that the vaccines work well enough against all major variants. We will talk about that momentarily. But first of all, cases which peaked at more than 255,000 cases per day in mid-January, an outrageous number. Not illegal, but certainly an immoral number, as I like to say. Cases are now down under 50,000 cases per day for the first time since October of 2020. It's been 7 months since cases have been this low, down to about 47,000 per day as of yesterday. This is now down more than 80% from the peak in mid-January, and these numbers should continue down and look even better by Memorial Day, certainly by mid-June. As far as deaths go, deaths peaked in late January at nearly 3,500 deaths per day, more than a 9/11 every single day. And those are now also down more than 80% to about 675 a day. Still horrible, but dramatically lower. And understand that daily deaths in the U.S. have not been below 700 a day since July of last summer. So that is going very much in the right direction. Deaths as low as they've been in basically 10 months. Now, globally, cases were coming down and are coming down in the U.S. Globally, we did see a spike led by countries like India and Brazil, among others. That has also turned around, not by much, but globally cases are now down about 3 to 4% from the peak that happened about 10 days ago. We hope that the global numbers will also start coming down more significantly as vaccines get to more and more countries. And we will speak momentarily about Joe Biden coming out in support of lifting or not enforcing patents on vaccines. I actually don't think that's going to make a difference, but I'm going to tell you why in the next segment. Earlier this week, I did tell you that vaccination is a growing problem in the sense that supply is now exceeding demand in many places. And we've seen average daily doses decline from their high of about 3.4 million a day, now down to just 2.1 million doses per day over the last week. That's not good, but it will still get us where we need to go as long as it continues. But the decline in doses led Joe Biden to announce a new vaccination initiative earlier this week. We talked about it yesterday. CVS Pharmacy has already met the call. They are going to be offering walk-in vaccination, no appointment necessary, at thousands of pharmacies across the country. But the really good news about vaccines is they work on the variants of concern. Dr. Eric Topol, former guest on the show, published yesterday a great infographic showing us that of all of the relevant variants so far, there's the British, South African, and Brazilian. Then there's the New York, California, and India variants. We have at least some evidence that the vaccines work. For example, with the UK, South Africa, and Brazil variants, we now have lab studies, randomized clinical trials, and real-world evidence that the vaccines work well enough on those variants that if we keep vaccinating, we can get out of this. For the New York, California, and India variants, we don't yet have the randomized controlled trials, but we have lab studies and we have real-world evidence. So we have a path out of this. Moderna and Pfizer, at minimum, are working on boosters that will be tweaked for the variants for the fall or winter. So the path is clear. By Memorial Day, we will have a better situation than we have today. And a little deeper, early summer, it will be even better if people keep getting vaccinated. Let's talk next about the patents. One of our sponsors today is BlueBlocks. I spend a lot of time because of my work looking at a computer screen, and peer-reviewed studies have shown that the blue light that comes from screens can actually lead to certain types of eye strain and even damage or blurred vision, headaches, dry, watery eyes. BlueBlocks fixes this by filtering out the blue light. And unlike other cheap blue light glasses, The effectiveness of Blue Block's glasses are backed up by evidence, and they're built under optics laboratory conditions. These are my Blue Block's glasses. I like how they look. They have over 40 different styles to choose from. I really have noticed a big difference where I'm no longer getting that eye strain and headaches from the computer screen because of the Blue Block's glasses. They have prescription versions and non-prescription and readers. They have something for every need, and Blue Blocks is giving you 20% off when you go to blueblocks.com/Pakman and use the code Pakman. The link is under this video, and you'll get free shipping on orders over $115.